Hi, I'm Dr. Tyran Mincey, and I'm here today to talk to you about something that we all are having to confront and deal with, and that is the COVID-19 situation. And it plays itself out in a lot of different ways in terms of what we have to deal with. One is the misinformation, fear-mongering, conspiracy theory, and various opinions of different public officials and private officials. It's difficult to know which way to go and who to believe. Today what I want to do is give you a perspective from a doctor who treats not parts of the patient, but the whole patient, the holistic way. And it's not that it's the only way to remedy this matter, it's just another viewpoint and more information that you can add to your arsenal so that when the time comes for you to have to make a decision, you are armed and ready to go. We'll do that today in three ways. We can't finish the whole thing in just 2 or 3 minutes like a TikTok video or a quick YouTube video where it's only a couple of minutes. We really won't do it any injustice. If you truly want to understand the situation as I'm going to present it today, you need to put a little time in. I have made an effort to put this presentation together in plain English, and today we're going to cover the current scene as it pertains to COVID-19 from the viewpoint of cases and asymptomatic people. Then we're going to cover the information that's out here with regard to COVID-19, the spread of it, and statistics that come from the Centers for Disease Control and other credible sources. And we're going to look at those from a different viewpoint than is seen in popular press. Finally, we'll talk about the actual vaccine, how it works, what it does, and we'll use some quotes from some noted professionals on the matter to add the topping to our arsenal in terms of information we can use to make a decision. It's my position to give you information that you could use from both sides of the spectrum, the pros and the cons. And I understand most of us have received all of the cons, mostly in the form of things that we have to do to stay alive and to save others, but there's another side that we all need to look at and have in order for us to, I think, make the best decision. If you're not a patient in the practice here at Integrated Healthcare, you should know my name is Dr. Tyran Mincey. I practice in Montclair, New Jersey. I'm a holistic doctor. We don't treat parts that have problems. We treat people that have parts that have problems. So we're doctors that treat the whole person. My area of expertise is on treating the whole person. So my viewpoint will come from the angle of treating the whole person, not just parts. I hope you'll tune in, share this with other people, and learn something that can help you in the decision process that you're going to have to make one day to vaccinate or to not vaccinate, or force people to vaccinate for that matter. I hope it helps. So let's begin. The first thing we want to do is we want to cover the current scene as it pertains to COVID-19. But before we can do that, there's some background information that I think you have that I want to cover to make sure that you can understand what the context is of some of the comments that I'm going to make in a few minutes. And that deals with our very existence here. That deals with what we call the stages of life. And we all know it. We've all seen it. But I want to remind you and put that on your radar so that as we talk today, you can think with that. So the first stage, of course, that we all know of is there's birth. And then if things go right, we will grow. We eat well. We nourish ourselves. We balance our body. And that growth process ends us up with an adult. And if we're fortunate, we'll get to midlife. And eventually, what happens to every single person, nobody gets out alive, is we start to have a decline. We all want a graceful decline. As we reach our 40s and 50s and we start to notice that the body isn't as strong as it used to be, or perhaps it doesn't function the way it used to, it's important to realize that that time that we're starting to have to pay for all the things we did in these early years. And if we're smart, there's a way that we can reckon that with natural types of remedies. But in either case, there is a natural decline that happens, and the end of that natural decline is the transition that we call death. It's interesting to note that in the eyes of insurance companies nowadays, doctors have to put codes down, and it used to be that a person was allowed to die of natural causes. But in our current culture and environment in this country, a person in the eyes of an insurance carrier is no longer allowed to die of natural causes. There must be a cause of death. So dying at 79, which is the life expectancy of an American at this point, can't just be death from a natural cause. It has to have a reason. It can't be death from old age. It has to have a reason. So it has to be a heart attack or cardiovascular disease or complications related to diabetes, any of those things. But those are the stages of life. And as I go through the presentation, I'll be referencing back the stages of life, and I will continually reference this life expectancy that we have in the United States of 79. And I need us all to appreciate we are born, we grow, we peak, and then there's a natural decline that no one escapes, that we all end up with a transition that we call death. Keep that with you for a couple of minutes as we go on to the next topic. As it pertains to COVID-19. We're going to talk about some of the statistics that come from the CDC's website, and we're going to analyze those a little bit more closely so we can have a better understanding of what they really mean. Viewpoint here is everything. In fact, Muhammad Ali must have said it best when he said, looking at life from a different perspective makes you realize that it's not the deer that's crossing the road. Rather, it's the road that's crossing the forest. Muhammad Ali. And we have to look at this from different angles and different perspectives. We can't always accept what is given to us as being perfect, because the people who are giving it to us are not perfect. The CDC's website showed us today, January 21st, 2021, there are 24,512,618,000 cases of COVID-19 in the United States of America. We are number one in the world in terms of COVID-19 infections, and we are beating all other countries by legions. So when we look at this number and we start to quiver and quake a little bit, we should also stop for a second and ask ourselves, why is that? How come so many Americans are being infected? Well, one of the fundamental differences between what we do here in the United States and the rest of the world is that the primary healthcare used in the rest of the world involves natural therapies, holistic therapies. 3/4 of the world uses drug-free therapy as their primary care, but not the United States. And one can't help but wonder how China could have 80,000 cases and 2,000 deaths in the first month, and then have a trickle of cases after that, per the reports. And they didn't immunize. They did have a lockdown that was very intense. But there's more to it than that. There's the culture that's steeped in herbal traditions. It has to make a difference. We know firsthand, based on research on blood work that we've done over 20 years, that Americans are inflamed most of their lives because of the diet that they consume, what we call the standard American diet or the SAD diet. Something like COVID-19, when it would enter the body, would have plenty of fodder for spreading in an American body, based on what we can see. So 24,512,618,000 512,618 cases. And out of that, 408,697 have perished. So if you look at this every day, this is horrible. This is a terrible way to start the day and listen to the news and turn on your phone. Number of cases reaches record high. More people have died. And then people leave their offices and their homes, and if they get a chance to leave, and they're scared because they keep seeing this number go up. But what's happening or not happening on the website for the CDC, and I don't know why, is they don't report the percentage of deaths. And the percentage of deaths is very important to know. From this day forward, when you go out, you need to know the percentage of deaths. The vaccination was just deployed in December. Yet the percentage of deaths now is 1.66%. Well, what was the percentage of deaths when it started? Well, based on past numbers that I looked at some time ago, back in May, or just before that, and this is rough because I'm sure I'll be challenged by some people, but if you go back and you look in the early part, you will see the death rate was almost 6%, somewhere between 5 and 6% for COVID-19 cases. Well, what sometimes happens with bacteria and viral infections is as they jump from one party to another, one person to the next, they sometimes become weaker, or they change, or they alter. And when that happens, they're not always as aggressive. So we see the death rate went from nearly 6, then in October it went to 2.9%. Yet the number of cases continued to soar. Then January today, we report 1.66%. It has declined steadily since it started, which is a thing that sometimes happens with infectious disease. And there was a study done at one university, and I don't want to name it, but I can give you the reference should you challenge it, where they found that the COVID-19 symptoms and aggressive behavior of the disorder had been declining steadily, and they were very happy to report in their study that they believe that the virus was weakening. And that's good news. And this number seems to support that notion. Likewise, patients that are coming into the office now don't seem to have as severe symptoms as they had before, or the main complaint is there's a persistent issue. So even though what we're doing isn't really working in terms of stopping the spread of COVID-19, the one thing that Mother Nature has done for us is, it seems this has been pre-programmed to kind of slowly become less and less aggressive as time goes on. That's what it looks like right now. I'm sure I could be challenged in many ways. I encourage you for yourself to go on and look as the days go by and watch the death rate continue to decline. It would be very surprising if it went up. And this is with numbers that we know may not be as accurate as they could be, because these deaths in these cases could be other illnesses that have been misdiagnosed, or in some cases false positives on the test, which is not perfect. So that covers the current scene in terms of cases of COVID-19. Let's consider the person or who it is that spreads COVID-19 from one person to the next. Epidemiologists know that in many cases this is not unique. So one of the things that's been presented to us is that we had to wear masks and we had to social distance because we could be carriers. Can you believe that? You should, because indeed you could be a carrier. But it's not any different than any other type of disease process, such as the common cold or other infections that people pass on. Or how about the hundreds and hundreds of coronaviruses that dog just had that licked you? Even though they might not make a human sick, we're still exposed to all these things, and we all have what's called a flora. And our flora is composed of different bacteria and different viruses. And none of us can escape it, and there's no amount of hand sanitizer you're going to use that's going to get rid of it. And you don't want that because it builds your immunity. But I want to address the idea that asymptomatic cases spread the disease. It is absolutely true. Asymptomatic people have always spread disease to other people, and symptomatic people have spread disease. It's typically considered that 20% of the asymptomatic people may spread a disease, bacteria, or virus to other people. It's the basis for human immunity. It's not a good thing when it's something that's deadly. But some of the things you may have heard of are Typhoid Mary, who in the 1800s spread salmonella from one person to the next because she cooked for people in a restaurant, and they became sick. And she had to be literally taken and put in isolation to try to stop the spread of this. But she had no symptoms whatsoever. Take Epstein-Barr. Epstein-Barr virus is a virus that 95% of Americans are infected with, yet they have no symptoms. Well, what does it cause? It causes mononucleosis, and that's not fun to have. Polio is another one, and there are others that are on this list, and there are millions and hundreds of thousands of others that are not on the list that people carry and have their own immunity to but don't get sick. And it's because the thing that determines whether or not a person gets sick, keep in mind now, there are 420 million Americans in this country. All 420 million Americans are not sick. What determines that these 24 million get sick and the other 420, less those, don't get sick? What determines that is immunity and susceptibility and some heredity. So we have to consider all these things in context. And so the idea that we would have to immunize all of the population, 420 million people, because of the asymptomatic, has some issues with it, because the asymptomatic are actually the ones who help protect and weaken and spread some sort of viral disorder so that people can build immunity to it. And that's not good when you bring it around people who are weak and who could be injured by it, but it is the current scene. So to review,
here's a result from search.
The current scene, there are 24,512,618,000 people, cases in this country. Keep in mind, 79 is the average life expectancy of an American. 79 is the magic number that I want you to keep in mind as you go through. I want you to remember that the number of deaths is 408,000, and that's a lot of people. But the percentage is 1.66%, and it has gone down. And for those of us who have lost loved ones, I understand. But the cycle of life is the cycle of life. The stages are the stages. And the life expectancy in this country is 79. And yes, there are many asymptomatic people, but that's not anything new. It's how we've survived for the last 3.5 million years and dealt with many viruses and outbreaks. We're going to take a break right now. So just because they're 65 doesn't mean they're going to perish. It's 65 with significant health problems, and they represent 29% of those over 65. So as you classify yourself and you put yourself in that group, you have to consider what a significant health problem is, and we've discussed that already. The third group that we have is all ages. That's everybody in the country with significant or hidden health problems. Now this is very important. You see, significant health problems still falls under the category of obesity, cardiovascular disease, or organs missing or replaced, right? These are significant health problems. But the area where people don't understand, because they don't treat it, are hidden health problems. And in the United States, one of the biggest things we have, and one of the biggest problems, is hidden health problems. So all ages with significant or hidden health problems. And this hidden health problems is where people go, oh, he was perfectly healthy. She was perfectly healthy. She had no problems at all. There was nothing wrong, and she got sick and she died of COVID-19. In my 23 years of experience as a healthcare provider, there's no such thing as a person who would perish, except for an accident where they crashed and were injured or killed instantly. Oftentimes we have people who come into the office and say that they're healthy, and they're not. They have hidden health problems which fall under the radar of mainstream medicine, because mainstream medicine typically manages patients in an emergency fashion. The person comes in, there's a problem on the lab test, it's identified on the lab test, blood test, or other study, and they're treated, which is the correct way to do it. But many of those people who have problems that don't meet that criteria fall under the radar. Also, you have a group of patients who don't go for health care, who are uninsured, who never get good health care, and so come down with a COVID infection, and no one really knew what was wrong with them in the first place. Very important. And in the African American community, where we are disproportionately affected, a lot of that has to do with immune system issues, inflammatory conditions of the body. These are things that are preventable that no one's taking care of. These are hidden health problems that went otherwise undetected and were not even looked for in some people because they didn't have health insurance and they weren't ill enough to go in to get care. And if they did get care, it wasn't detected on standard laboratory testing. But healthy, functioning people don't just die. That's the third group. The fourth group, all other people in this country. That means 84% of the United States would be a grouping and would not be considered high risk for dying from COVID-19. I think it's important that we put in perspective the idea that things that are similar, like having an infection in all of us, are not identical. All of us are not going to die from having an infection because we are in different groupings, we have different levels of immunity, we have different health problems and health benefits, and we have different ways of living and taking care of ourselves. That's like saying all of mankind would perish because of it, and you see how China and countries or 3/4 of the world that use herbal types of solutions and natural solutions don't seem to have the same case rate nor death rate as the United States, who depends upon mainstream medicine for wellness. Which group are you in? Let me know. If you're in one of these groups with significant health problems, alternative therapies and alternative healthcare can help you. Things like supporting with vitamin D, and I covered these in my other lectures that you should tune into. There are lots of things that can be done. One of the most important things is vitamin D, especially for people who are African American, but there's a list of other nutrients that people should take care of. I'll discuss why vitamin D is so interesting and important in the next session when we talk about the actual vaccination, or in the next section when we do that. Now, let's continue. 79 is certainly over 65. Keep that in mind. You remember what 79 is? 79 is the average life expectancy for an American. There are people that live beyond it and there are people that live below it, but 79 is the number that's there. Let's take a different look now that we've checked out these groups and you've identified what group that you're in. Let's now consider what the numbers have told us in the last year up to about last week. This is a breakdown of age by age of COVID-19 contractions and deaths as of 1/19/21. So we start off with the age of 25, 35, 45, 55. The ages of 25 through 55 don't really have anything next to them because they're very small numbers of cases that are present in that group. So I just totaled them and we said 19 roughly, in case I have someone who wants to be down to the digit, it's roughly 19.5% of all COVID-19 deaths occurred in this death group. These people fit into the category of the people we talked about, all ages with significant or hidden health problems. That's an important differentiation to make. They make up 19.5% of all the cases. The rest of the people who are under 55, all the way to 25 and below, are hardly likely to die if we use a history of what happened as an opportunity to predict the future. given the data that the virus is becoming less virulent, the likelihood that one would contract COVID-19 if they're in those age groups would have to seem to logically go down. Let's continue looking at greater than 65. 21% of all COVID-19 deaths are from people that are greater than 65. I'm willing to bet that 21% is people who had significant health problems. I actually had an opportunity to view a few death certificates, and indeed the ones that I saw confirmed that very thing. The people were not healthy. Their immunity was compromised. We go down here and we look at greater than 75 years of age, and we see there's 90,744 people who perished, who made their transition with the help of COVID-19, which makes up 29% of all those to date. What's the average life expectancy of an American? So 29% of the people who perished to date are pretty close to life expectancy. And again, this takes nothing away from people who lost a loved one. It is tragic indeed. But we're looking at what the numbers are, what they report, and what the probability and likelihood is that one would contract COVID-19 if they did nothing else but take halfway decent care of themselves. Continuing, if we look here at greater than 85, these people have exceeded life expectancy, 105,673 cases. And people who had blessed lives, the age of 85 or older, who perished after getting an infection with COVID-19. Why? Are the people who are 75 and older experiencing an end-of-life transition that happens directly related to what we said were the stages of life? There's birth, there's this peak, and then there's a decline in the transition. Could it be that COVID-19, because we have to put a diagnosis down, people aren't allowed to die of natural causes. The last time I checked, they died of something. Could it be that these 105,000, nearly 32% of the calculated deaths in the CDC's numbers, have perished because it was an end of life, a transition? You can answer that question. But when we total up the majority of deaths, and we include the 65 and older category, we have 80.5% of all COVID-19 deaths since the start of this pandemic have been directly related to people over 65 who fit in the grouping significant health problems, which CDC says is 29% of all the people over 65. So when we start looking at the idea of mass inoculation to prevent the spread of COVID-19, but ultimately not to prevent the spread, but to prevent deaths from the spread, because if we don't want something to be contagious and spread, we have the common cold, we have other things that are not fatal that people get. Yet COVID-19 is becoming weaker and weaker and weaker and appears to be looking like a really bad cold. I'll let you make the decision. When we come back, we'll look at the vaccine. We'll talk about some of the ingredients briefly in the vaccine, and we'll talk about some viewpoints from around the globe as it pertains to the COVID-19 vaccine. COVID-19, the vaccination, and giving you another viewpoint on the vaccination to help you make a decision as to whether or not you move forward with it or protest it being made mandatory in any shape or form. So there's two burning questions that come to mind with the vaccine now that we've covered some basic things regarding population and other types of things, and those questions are: the big one, what is in the mRNA vaccine? What's mRNA anyway? And two, How does it work? And mRNA vaccines are based on cellular activity, and they impact the cell's activity on the level of the genes. They impact the cell's activity as far as making proteins and making a defense. And the immune system is not that well understood, so going in and doing something that impacts a cell's ability to fight something may have unknown consequences. It's a really big conversation, especially when some of these things don't have longevity or proof behind them. So there's not strong evidence that this is effective as far as the vaccine is concerned. And we could talk about that for a long period of time, but it's mounting and it's building, and the evidence we have started in March when the first vaccination was given. But what's in the vaccine? Well, there are about 8 ingredients in the vaccine. Out of the 8 ingredients, the first one, which is mRNA, is a synthetic or genetically kind of altered type of mRNA. And I read a really good article about how the researcher struggled for many years to develop this, and every time they gave the mRNA to mice, they had these horrible immune reactions. And it was a synthetic form, so they had to go in and change some of the molecules without getting too detailed to try to get it to sneak by the immune system's detection. And they were successful. And once they were successful, this is what we now have today. And that happened in maybe 2005. And then naturally biotech companies and other companies that have an interest in having access to a person's cellular mechanisms and the instructions of that cell got very excited and bet on it big time. And those two companies are Moderna and Pfizer, to the tune of $1 billion, I believe it is. The investments have been made so that they could develop these vaccines. So the mRNA vaccines contain the mRNA, which is synthetic and has been sort of altered so that it will be able to access a cell. And mRNA is just a little strand of protein that has the ability to travel in and out of a cell. And it's essentially instructions for making things, hormones and immune system components. It also contains different types of fats. It'll say lipids, and lipids are another word for a type of fat. And those lipids are synthetic and were created in 2016. And I'm not aware of any detailed testing on what those lipids do to the human body. So that yet is another issue that you're putting in. Now, not only do you have this synthetic mRNA that has been altered, and we know before the alteration had a tremendous impact on immune function, but we also have this lipid that is synthetic and recently manufactured. The patent is 2016, and I'm not aware of any testing in humans. And there's very little evidence on mRNA vaccines in humans. We only have the 2020 information to know if it is indeed safe. There are a list of other ingredients, but the top 3 are the ones I have talked about. There are different types of sort of mineral combinations or minerals that are in the vaccine. Some of them, in a small number of people, cause a violent immune reaction called anaphylactic shock. And sometimes that can lead to death, but there were only a few people that could have that reaction. So we don't know, because the body is so complex, what the reaction will be when we put or inject things into the body. So for one person, it could be some type of shock or a violent immune reaction. For the other person, it might not be anything. So it's very important when we start trying new things to give that consideration. So those are the main ingredients. There are 8 other ingredients. I don't think we need to go into those in great detail. They do have, if you inject anything in the body, you can have a reaction. So compared to other vaccinations, these ingredients appear to be less harmful, but they also haven't been tested long enough to make a determination if they are indeed harmful. We'll find out in the people that choose to go get the vaccine, as we already have, and there have been some news headlines about a few people. In fact, China officials have decided that they don't believe the vaccine was tested long enough because of 23 deaths in Norway. So, and they've concluded that the mRNA vaccines have not been tested long enough to prove safe. Stay tuned. The second question, how does it work? Well, this is fascinating. Vaccines work, and this particular vaccine works because we're trying to stimulate a very important cell in the body, an immune cell. And this cell, I'm going to draw a picture of it here, looks a little bit like this. And this is a really important cell to your immune system. And it's called, just so you know the name, a dendritic cell. And dendritic cells have this very important activity. And I talk about this in previous episodes, so you can tune in, so I'm just going to mention it briefly. But the most important thing is when the mRNA goes into the cell, or a virus or bacteria goes into the body, not the cell, this cell is sitting there just waiting. And then it goes and it attacks and takes a piece of what's there that shouldn't be there and goes back and tells the rest of the immune system, you need to respond, you need to come back, you need to do something about this. And then the body takes that and creates an immune response and makes defenses. One of those defenses is called antibodies. So these vaccines are thought to and have the goal of stimulating these dendritic cells. And many of the ingredients that are in there are designed to try to get a greater stimulation of dendritic cells, so they'll pick up that mRNA, that protein, and go back and create an immune response. That's how it works. Now here's the really interesting thing that people really haven't spoken about. And that is that this dendritic cell is activated by vitamins. That's right, it's activated by vitamins, and I talk about this in other presentations. Specifically, the dendritic cell is activated and caused to mature and caused to create a greater defense and reaction by adequate levels of what? Vitamin D. So the scientists and researchers have to know, if I know, I think, or maybe they don't know, but there are at least 420 articles in the scientific literature that talk about the virtues of vitamin D and how it impacts immune function. Furthermore, there are papers that talk about the role that vitamin D plays in the activation of these cells. So if the vaccination works this way, by stimulating this cell to cause an immune response, why would we not focus on making sure that people have adequate levels of vitamin D? If that's how the vaccine works, why wouldn't we do it the other way? And the question and the answer has a lot to do with finances, research efforts, and things that people have done, and probably some other things that go beyond the discussion of this program. But for now, you know what's in the mRNA vaccine. You know how it works on the surface. And we don't know, once we stimulate dendritic cells with something artificial like mRNA, just how far the immune system will go. We do know that vitamin D has been around, the sunshine vitamin, for as long as this planet has been around, stimulating people's immune systems to work. There are some cautions if you decide to go take vitamin D that you should be aware of, and you should work with someone knowledgeable who understands how to get the most out of the vitamin D for your body. Next, we're going to talk about the FDA's recommendations of why people should get vaccinated, and I hope you are able to stay tuned to check that out. To use this information, or will be able to use this information in making your decision as to what it is you would like to do, how you would impact or talk to your elected officials, because we are at the point where not only do we need to take action to perhaps protect ourselves, but we need to work with our elected officials and get them to understand and see why this might not be, or why it might be, whatever your side of the story is. The reality is there's tremendous corporate lobbying probably happening, and if we don't speak up, this could go in directions that we might not want it to go. And for those who are pro, it's fine. But for those who are against, you have to understand that there will be a requirement for you to speak up, because silence is consent. So let's look at the FDA's reasons, in all fairness, for getting a vaccination taken directly from their website. The first reason the FDA gives us for getting reasons to vaccinate is that it's a safer way to build protection. And we've talked extensively about that. And because this is the first time that the vaccine has been introduced, my question is, safer than what? Because it's never been used before. So if it's never been used before, can we really compare it to anything that we've done? I guess we could compare it to other vaccinations, but there are 3 different new technologies in this vaccine, at least, including the mRNA, which, even though the research was started in 1995, the actual use of mRNA in this application is brand new. While the study, according to some officials at NIH, of coronaviruses has gone on for many years, at least 6 years the research has gone in, using the mRNA strand as a carrier of part of a coronavirus and putting that into the human body is new and has been tested effective March of 2020. So all we know is that whatever has occurred since March of 2020, we can draw conclusions based on. The Chinese officials, China has done very well, and I don't know everything that they're doing, and I don't think any of us does, but we do know that their case report initially was 80,000 people. It went down to and it had 2,000 deaths related to the COVID-19 pandemic. And then after that, it just dropped off to very low case levels. And part of that does have to do with culture, as I alluded to earlier. But the other part of it is there's something that they're doing that we're not doing right. If we're trying to prevent death, one of the things we have to look at are nations that are successful at doing this. And so there's something that China did outside of vaccination, because it hadn't been developed yet, that made a difference. And their officials say that they do not believe there's enough research, time, or evidence behind the use of mRNA vaccines. And so their vaccines that they've developed are old-time vaccines that use weakened viruses. And I'm still not a fan personally of that, but it certainly is better than something that's only 10 months old, in my opinion. You get to decide what's true for you. So it is a safer way to build protection, is what the FDA says, and you make the decision. You understand some basic foundations of what the ingredients are, and you also understand that there are some alternatives out there. And you should tune into the other programs I have on the immune system so you can get further information on that. The second point that is the CDC's reasons to vaccinate is it is important to help stop the pandemic. It is important to help stop the pandemic. And I don't know what the answer is to that question per se. I just know the numbers that I showed you earlier that suggested that some of this might be related to end-of-life processes. And that 80% of the cases were coming in the part of the population that is getting close to life expectancy. That doesn't mean we shouldn't do things to protect these people by any means. I'm going to be that age. I have parents that are that age. But I don't know that we should use something that we don't know if it's actually going to work. We have to see. But that is what the CDC says. These are the 2 reasons why a person should go out and get themselves vaccinated with the new mRNA vaccines that are presented by Moderna and Pfizer. We're going to talk a little bit more about and do a review of what it is we've been talking about here today. We'll take a break for a second and come. We talked about today. I hope we've given you some useful information that you can take back with you and put it to work so that you can make a decision that makes sense for you, and you at the same time can respect whatever decisions other people might make with regard to their health. Because we are aware that there are different groups of people, and each of those groups has certain concerns and has to do what's right for them. It just so happens that many of the people that have more concerns happen to be part of our older population who we respect, love, and cherish as they go through the various cycles that exist in the life of each and every one of us. As a reminder, our summary here talks about the idea that there are stages in life that each of us will go through and none of us escapes them, even if we take a drug, a vaccination, or have surgery. Ultimately, it becomes birth, growth, a peak, some sort of decline, and ultimately death. And we know that in the United States of America, that death, that represents a life expectancy, an average life expectancy of 79 years of age. 79 years of age happens to be a place where a large portion of deaths from people with coronavirus seems to lie, based on what we covered today. And it's something for us to consider as we think about the idea that if we take an inoculation or a vaccination, the question arises, is it necessary if it's impacting that percentage of the group? Is it necessary if we are seeing that the death rate has actually gone from 6% to 1.66% since coronavirus has arrived on the scene 1 year ago? That's pretty significant as well. While the case rate continues to rise, well over 24 million, the death rate is going down and seems to be an indirect indicator that it may not be as virulent. However, when we interpret this, and people will say we have to be careful with this, and we sure can, we have to be very careful with this. And when we interpret it, we have to realize that in back of the interpretation now is an economy that surrounds the coronavirus. An economy that consists of people making very large sums of money on masks, on advertising, on testing, on safety precautions and hand sanitizer, and we could go on and on. There's millions and millions of dollars that have been generated, not to mention the huge investment that drug companies have made in creating vaccines for this very thing. I'm not expecting for drug companies and other companies to come forward, or nor the government, and say, don't go vaccinated, because there's so much money in this right now that it's hard to go back in the other direction, which would probably be the right thing to do if the information that I have obtained from the CDC's website is accurate. Not all people have the same risk factors. People who have coronavirus fall into different groups. There are high-risk categories and low-risk categories. And it seems that many of the higher-risk categories fall into a small 29% range of those greater than 65, many of whom happen to be over the age of 85. Many deaths may be part of the stages of life. So the many deaths we have might be that 85-year-old who contracted corona and passed away. This is part of one of the stages of life. We could not have immunized that away, I don't think. And if we did, perhaps the life expectancy would not have been very many years later, since the average is 79. All people carry bacteria and viruses. This goes to the point that we made earlier about asymptomatic individuals. For the rest of your life, you will be a carrier of some type of virus or bacteria. This is why there's always a push for you to wash your hands after you do it. It's been a lifelong kind of thing. But to think that all of a sudden you are a carrier because of coronavirus is simply not true. It is reasonable and practical to take sanitary measures to cut down on transmission. However, I've run into people who feel bad if they do something because they feel like they're harming other people. And I'm not sure that's necessarily the case. If that is true, then each of us has been harming people since we set foot upon this earth, with all different types of disorders and types of problems, especially when we look at the death rate from this particular problem spanning toward the end or the final transitional stage of life. Finally, there are many unknowns about mRNA vaccines. China will not use them. So there are many types of options for vaccination for coronavirus, and I didn't have a chance to go into the others, but I do think much of what's presented here still applies to the other vaccines. We have too many unknowns on the mRNA vaccines, and there just hasn't been enough time in my mind to develop these to understand what the long-term risks will be. So no one can speak to long-term risk because there hasn't been a long-term trial. Yet nature has found a way for 3.5 million years to combat viruses and bacteria. One of the most important things you can do, as I talked about earlier, is go back and look at a couple of the earlier videos where I talk about stimulating your immune system. And the value of proper vitamin D levels cannot be understated, since the vaccines seek to stimulate the very same cell that is activated by vitamin D. And in a patient who doesn't have sufficient vitamin D, that cell will be lazy and underperform. My detractors will say there's no studies on that, and you're right. We just have hundreds of years of use of people using these things anecdotally versus 6 or 7 months of a vaccine. You get to choose. But ultimately, no, should you choose to follow the path of natural remedies, work with a professional who understands how to get you to the levels you need to be so you can be protected. If you choose to follow the path of getting vaccinated, you still need to work with the professionals because the unknowns tell us that we don't know if you'll have permanent immunity. I'm glad you took a few minutes to listen to what I had to say in my presentation about an alternative viewpoint on COVID-19. I'm Dr. Tyran Mincey. Thank you, and should you have questions, please feel free to reach out to us. I wish you the best in all the decisions you make regarding this matter, and should you be a person who's against it, you've got a fight ahead of you, quite possibly, so remember this one statement as I leave you. Silence is consent. Thank you.